Hi, good morning everyone. This is Dr. Chinmayee Joshi, ENT consultant at the Orthopedic Hospital, Navavadaj, Ahmedabad. This video is directed towards all those parents who are having their kids in the age range of 0 to 5 years. It is a highly taxing area in terms of new parenting as well as scary stories of present parenting times. But what, as an ENT surgeon, I would like you to be aware of is about the possibilities of foreign bodies. Foreign bodies, be it metallic, non-metallic, plastic, or vegetative foreign bodies like peanuts, chana, peas, or anything of that sort. Now, as a child grows, he is trying to understand various textures and the quality of materials by practicing its feel. The first feel he is going to understand is orally. Rest of the other orifices of the body are a area of discovery for the child. So rather it is getting angry and frustrated by the act of the child when the child puts in a foreign body in an abnormal zone. It becomes the responsibility of the parents and the caretakers to be highly aware of the accessibility which we give to the child of various certain things which might end up being life threatening in certain cases. Today, this brief is only regarding the nasal foreign bodies. Now, nose becomes a highly accessible zone for the child to experiment the feel it gets by putting the certain materials in the nasal cavity. The structure of the nose and the size discrepancy is a blessing in certain times that the foreign body gets struck at the anterior part of the nose, which is a zone of easy catching and accessibility even for the surgical person. But once it crosses a certain zone, it becomes difficult for us to handle these foreign bodies with the child being conscious. So, as a parent, what we have to do is keep the child away from certain foreign bodies, as I named a few, like especially the vegetative ones, like the peanuts, peas, or something of that sort, and the most dangerous ones, like the harmfully metallic parts, plastic parts of the toys, or rounded cell batteries, which would be harming, burning rather, their mucosa if it gets stuck in those certain areas. Rather, what you can do at your level is firstly that try to contact your trusted physician, doctor, healthcare facilities to get to the channel or to the trusted ENT surgeons so that they can deal with it technically without harming or without damaging the mucosa around. So do not attempt to remove it at home. Do not feed the child. Do not try to cough it out or try to make the child in an abnormal sleeping position if you really don't know where the foreign body was. And yes, the person who has seen the episode and was around has to accompany to give the proper history. Only after that the assessment can be complete, and if the foreign body has slipped posteriorly, it becomes a medical emergency for us to deal with such foreign bodies. So make sure that you are being aware of where your child is playing and make the things less accessible to them which are dangerous, because it is not the fault of the kid. The kid is going to understand things by experiencing, whether it is by putting in the mouth or in the nose or the ear. So we'll be talking about in detail for other types of foreign body, but here what I want to emphasize is that the nasal foreign bodies can be dealt with correctly if they are in the anterior part, if you have a history, if you have seen the episode, or if there is some sort of foul smelling discharge from your child's nose, only from one nostril, and you feel it is a stuffy nose for a long time, where you are really don't know the history and it is unaware history of that part of the foul smelling discharge. Try to reach out to your ENT doctor, trusted ENT doctor, get an assessment so that the foreign body doesn't get struck and undergo other organic changes at the local site. And this was for public awareness. Technical details of the same are difficult to explain without demonstration. So hence, I would urge all of you to be aware of what your child is playing with. Be conscious around them, because with this mobile addicted era, we really are preoccupied with multitasking, and this multitasking might end up with some sort of difficulties for our own kids. Thank you so much for listening to this patiently.